Good afternoon, my dear students. So today we are going to discuss occipital bone. So occipital bone is one among the 8 cranial bones. It lies in the occipit or back of the head. The shape is this trapezoidal shape. About the anatomical position, the anterior surface, it should be concave. Posterior should be convex. Now it has 3 parts, and basilar part, then condylar part and squamous part. Now squamous part, it is the expanded part and it lies, and this bone encloses a large foramen known as foramen magnum. Now regarding the position of the 3 parts, the occipital part, it should lie above the foramen magnum. The basilar part, it should lie in front of the foramen magnum. And the 2 condylar parts, it should lie laterally. So this is condylar part, this is basilar part, and this is our squamous part. Now let's discuss about the each parts. That first is squamous part. So squamous part has got 2 surfaces, anterior surface and posterior surface, or internal surface and external surface. Then 3 angles, superior angle and 2 lateral angles. In this curve here we can see this is our superior angle and this is our lateral angle. So 2 lateral angles and 1 superior angle. And 4 borders, that is 2 lambdoid border and 2 mastoid border. Now regarding the external surface. So the important feature of external surface is the presence of external occipital protuberance. It is an important bony landmark and it lies between the posterior border of the foramen magnum and superior angle. Importance of the external occipital protuberance is that it is an important bony landmark, that it can be externally felt. Then opposite to the external occipital protuberance, here the superior sagittal sinus ends and 2 transverse sinus begins. Then regarding the attachment, it gives attachment to the highest point of ligamental nuchal. So that is about the external occipital protuberance. Next feature of the external surface is the highest nuchal line. So it is not well marked. It may be present or absent. So if highest nuchal line is there, it gives attachment to gallia aponeurotica. Above the gallia aponeurotica, it is covered by the muscle known as occipital belly of occipitofrontalis. So that is about the highest nuchal line. Next is the superior nuchal line. So here you can see superior nuchal line which runs on either side of the external occipital protuberance. So this highest nuchal line, it gives origin to 2 muscles. Medially trapezius muscle and laterally occipital belly of occipitofrontalis muscle. So medially trapezius and laterally occipital belly of occipitofrontalis. Below the lateral side, it gives insertion to 2 muscles, splenius capitis and sternocleidomastoid muscle. So that is about the highest superior nuchal line. Next is the external occipital crust. So here you can see a well marked ridge. which is known as external occipital crust, which begins from the posterior border of the foramen magnum up to the external occipital crust, and this gives attachment to the ligamental nuchae. In the midway between the external occipital crust, line runs laterally, and that is known as inferior nuchal line. So here you can see a well marked inferior nuchal line, and this line gives insertion to the rectus capitis posterior minor muscle. Now the muscles which are attached, summary of the muscles which are attached to the external surfaces are: between the superior nuchal line and inferior nuchal line, medially there is attachment of the, or there is insertion of the semispinalis capitis muscle. Laterally, obliquus posterior superior muscle. Below to the inferior nuchal line, the surface is covered by the, or inserted by the rectus capitis posterior minor muscle medially and rectus capitis posterior major muscle laterally. Superior nuchal line below to that gives insertion to two muscles, splenius capitis medially and sternocleidomastoid laterally. Regarding origin of two muscles, on the superior nuchal line, two muscles, trapezius and occipital belly of occipitofrontalis muscle. So this is the general description and the muscle attachments on the external surface. Next, we move to the internal surface. So internal surface, it is concave. The important feature is the presence of internal occipital protuberance. So internal occipital protuberance, above we can see here a sulcus, and this is known as superior sagittal sulcus, which is related with the superior sagittal sinus, and the margin of the sulcus gives attachment to lower part of the falx cerebrae. On either side of the internal occipital protuberance, we can see the transverse sulcus, right and left transverse sulcus. So the transverse sulcus is related with the transverse sinus, and the margin of the sulcus, here you can see sulcus, margins of the sulcus. So margin of the sulcus gives attachment to tendorium cerebellae. Next feature is the internal occipital crust, which runs from the posterior margin of the foramen magnum to internal occipital protuberance, and this crust gives attachment to falx cerebellae. Now these four lines, that is superior sagittal sulcus, then two transverse sulcus and internal occipital protuberance, divides the internal surface into four fossae, that is two upper fossae and two lower fossae. Upper two fossae lodges the occipital lobe of cerebrum, and lower fossae it lodges the cerebellar lobes. Below the internal occipital protuberance, here you can see the Vermian fossa. This is the Vermian fossa, and it contains the vermis of the cerebellum. So that is about the internal surface of the squamous part of the occipital bone. Now next is the superior angle. So superior angle is situated where the two lambdoid borders meet. So here you can see two lambdoid borders, they fuse at the superior angle. So at the superior angle, two lambdoid border and the parietal border fuse, and this forms the lambda. Near the inferior, there are two lateral angles, two lateral angles lie where the lambdoid suture is fused with the mastoid suture. Now the importance is that lambdoid suture and mastoid suture along with the parietal bone where it fuse. Now this bone, this part forms an important bony landmark and this is known as asterion. Asterion is the site where the three bones meet, that is occipital bone, parietal bone and mastoid part of the temporal bone. So that is regarding the three angles. Next, regarding the four borders. So the four borders are two lambdoid border and two mastoid border. So here you can see the mastoid border. So lambdoid border, it articulates with the parietal bone to form the lambdoid suture. Mastoid suture, it articulates with the mastoid part of the temporal bone. And the suture we can call it as mastoid suture. So that is regarding the borders of the squamous part of the temporal bone. Next we shall go to the basilar part of the occipital bone. So basilar part, it is a quadrilateral part and it lies in front of the foramen magnum. Anatomically, you have to hold the bone in this way, in such a way that the basilar part should face forwards and slightly upwards, should lie slightly upwards. Now regarding the surfaces, it has got three surfaces: anterior surface, superior surface and inferior surface. Three borders, two lateral border and one posterior border. So here you can see the posterior border. Now attachments. Anterior surface, it articulates with the body of sphenoid. So here you can see the body of sphenoid. Now this is the anterior surface. So anterior surface articulates with the body of sphenoid and it is the cartilaginous joint. It ossifies by 25 years. Next is the superior surface. So superior surface, you can see it is hollowed. Depression is there. And this part is known as cavus. And it holds the pons, lower part of pons as well as medulla. Next is inferior surface. Inferior surface has a tubercle known as pharyngeal tubercle. And inferior surface gives attachment to fibrous raphe of pharynx as well as upper fibers of superior constrictor muscle, because from below our pharynx starts. So here it gives attachment to superior constrictor, upper fibers of superior constrictor muscle. So that is regarding the surfaces. Next, regarding the borders. So it has a posterior border. Posterior, this is our posterior border. So this posterior border, it forms the anterior margin of foramen magnum. Then two lateral borders are there. These lateral borders articulate with the petrous part of the temporal bone. So this is our petrous part of temporal bone, and here you can see this is the lateral border which articulates with the petrous part of temporal bone. Superiorly, it is related with the inferior petrosal sinus. So here you can see this groove. This is for the inferior petrosal sinus. So that is regarding the basilar part of the occipital bone. And our last part is condylar part. So condylar part, because it contains two occipital condyles. That is the importance of this part. Now this condylar part, it forms the lateral margin of foramen magnum. It has two surfaces, superior surface and inferior surface. So let's discuss first inferior surface. So inferior surface has two condyles known as occipital condyles, and these condyles articulates with the atlas bone to form atlanto-occipital joint. So here you can see the atlanto-occipital joint. Anterior, above the condyle, anteriorly, here you can see a foramen or a canal. This is known as hypoglossal canal. Through hypoglossal canal passes the hypoglossal nerve. See, here I am putting this probe. Here you can see this probe. So this is for the passage of hypoglossal nerve, which supplies motor supply to the tongue muscles. Now above the hypoglossal canal, you can see a small tubercle known as jugular tubercle. So canal lies above the jugular foramen. Behind the occipital condyle, you can see this depression, and this depression is known as condylar fossa. So when our neck is flexed backwards, our arch, lateral mass, it is holded by this condylar fossa when neck is extended backwards. Okay, that is the importance of this condylar fossa. Next regard, so that is about the inferior surface. About the superior surface, we can see the jugular foramen or tuber jugulum. Above the jugular foramen, there is, here we can see a canal, and this forms the sigmoid sinus. Through this passes the sigmoid sinus, which later opens into the internal jugular vein. So that is regarding the condylar part of the occipital bone. Now last our part is foramen magnum, which is the largest foramen of our skull. So this jugular foramen, if we go through the boundaries, anteriorly it is bounded by the basilar part, laterally it is bounded by the occipital condyles, and superiorly it is bounded by the squamous part of the occipital bone. Now this foramen magnum, it is divided into two compartments by alar ligament. For example, this is our alar ligament. It is attached like this way, and it divides the foramen into two parts, anterior small foramen and posterior large foramen. Anterior small foramen gives attachment to apical ligament, cruciate ligament and membrana pectoria. Through posterior compartment passes the lower part of medulla, which become continuous with spinal cord. Then vertebral artery enters into the skull. Two vertebral artery enters into the skull through the posterior part of foramen magnum. Then anterior and posterior spinal arteries, sympathetic plexus which surrounds the vertebral artery, and lower part of the tonsils of the cerebellum. Then accessory nerve, downward extension of the accessory nerve. So this is regarding the occipital bone.